Hi everyone, and my name is Hema. This is FNP 596, and I'll be discussing one of my clinical uh, patients or experiences with all of you. I apologize for my background. Unfortunately, I had to get into my car in order for me to have a quiet area to discuss my experience here. So my patient is 65 years old. She is a Hispanic married female with the date of birth of June 1st, 1959. Her insurance is IEHP insurance, and Mrs. M presents to the clinic accompanied by her husband. And during this initial contact, she appeared to be well, no signs of acute distress, and she was a reliable source as far as providing information about her clinical diagnosis or chief complaint, excuse me. Our subject here, our chief complaint, is Miss M. As stated, she states that she's been having a headache that will not go away. It started yesterday, and she stated she feels a bit lightheaded. Her HPI consists of the following. Mrs. M, once again, is a 65-year-old Hispanic female who presented to the clinic accompanied by her husband, her significant other. She's been having a headache for about a day now, and states that it has been feeling a bit worse. She expressed that her pain was about an 8 out of 10, describing as a pounding, primarily localized and bilateral temples. Did not radiate anywhere else, but it was just very localized. Headache, she stated, was worse with light, and certain smells made the headache worse. Ms. M further stated that she did not have nausea at the time or vomiting, as well as not taking any medications for the headache that she was experiencing. She also denied any fever, chills, or any recent travel. She denied anyone being homesick. So with that basic history, she did state as well that she did have history of high blood pressure, and that she had not taken her medication as a result of saying she was feeling better. And so her interpretation or idea was that if she was feeling better, there was no need for her to take her blood pressure medication. Her past medical history, like I stated, consisted of hypertension times 5 years. All of her preventive cares had been addressed. Her physical was last year. Her cervical cancer screening as well. Surgeries, she did have a bilateral tubal ligation back in 1999 and never had been hospitalized. Her last menstrual period, she states, was exactly a month ago. No known drug allergies. She was up to date with all of her vaccines. No drug allergies. She did state, however, that occasionally she would take the Tylenol 500 milligrams when she did have headaches in the past, and once again might have been a result of just having that elevated blood pressure and not being consistent with her meds. She did say that her medication regimen was lisinopril 20 milligrams and was doing that twice a day for her hypertension. As far as her family history, both parents have been deceased. Mother was deceased at the age of 86 due to glaucoma and complications of diabetes. As far as her father, he passed away at the age of 88. History of hypertension and coronary artery disease. Maternal grandparents, for our patient, the maternal grandmother, passed away at the age of 78, also with diabetes type 2. And maternal grandfather passed away at 79 with hypertension. Paternal grandmother passed away at 96 due to the heart attack and history of high blood pressure. And paternal grandfather passed away at the age of 90 and just of old age. Social history, she did deny any recent smoking or smoking at all. No history of smoking, drugs, alcohol. She did say she maybe will have an occasional beer socially at family gatherings, but nothing other than that. Enjoys being with her grandkids. She is retired, has been retired. She owns her home with her husband, and they like to just enjoy physical activity and do a lot of gardening work. When we did the focused exam, basically we addressed the constitutional system here, denied general fatigue, malaise, or weakness, like I stated. She did state yes to sensitivity to light, does not use glasses, or had any visual disturbances. Head and neck, nose and mouth and throat, denied any head injuries. However, she did have, like I said, the headache that was very localized, pointing to her temporal area. Mild lightheadedness, is she also stated, but no facial numbness or discharge, ringing from the ears, sore throat, or difficulty swallowing. Cardiovascular, she denied any chest pain, shortness of breath. Musculoskeletal, denies any stiffness of joint. Psychiatric, no history of anxiety or depression, suicidal ideation. And allergies, like I stated, nothing. As far as objective, her vital signs once again were elevated. They were 178/99, heart rate 92. But other than that, once again, everything was normal. Her pain was unfortunately 8 out of 10. And she was in the obese side with a weight of 185, putting her at a BMI of 30.8. So our concern with her and seeing her in clinic was definitely the blood pressure of 178/99. Upon her assessment, or my assessment, patient once again alert and oriented ×4, no visible distress other than the noted blood pressure. When we did her HENT, normal cephalic, head was symmetrical, no facial flushing noted. Maxillary, and frontal sinuses were non-tender, so with no pressure or pain there. Pupils were equally round and reactive, accommodated to light. Tympanic membranes, were intact as well. And the mucosal lining was intact, no septum deviation. Uvula was midline, soft, and hard palate was intact. Gums were non-inflamed, and she had good dentation noted. As far as her neck, no no lumps or masses noted. Thyroid was midline and no tracheal deviation. Her cardiovascular S1 and S2 heart sounds were noted. She didn't have any abnormal heart sounds, no bruits noted. Capillary refills were +2 upper and lower extremities, and no edema as well. As far as pulmonary, she did have good excursion, no labored breathing or adventitious lung sounds. And for her, our differential diagnosis was a migraine headache, acute sinusitis, and otitis media. Our final diagnosis with her was acute headache secondary to elevated blood pressure. And so basically what we did with her, we made sure we did a lot of patient education. We focused on the importance of taking her lisinopril milligrams by mouth daily. We repeated her blood pressure, which at that point was 160/80. We didn't have any other concerns. Once again, we gave her Motrin in clinic to help with the headache. Educated her once again on the importance of lifestyles and medication adherence, a DASH diet, and we basically instructed her or scheduled the appointment to follow up in 5 days with us, and of course gave her reasons and the symptoms as far as being reassessed in the emergency department if symptoms became worse, such as a pounding headaches, headache of her life, a blood pressure reading of greater than 160/100, shortness of breath, chest pain, and so forth. And this was basically the information that we provided to her as far as the management of care.